Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne scars, on acne, on facial balancing. I do a lot with pigmentation as well. I'm going to showcase this result right here tonight. This is a really, really nice result because it's somebody who had a traumatic scar on her forehead, was really troubled by it, and we achieved it really, really nicely. If you look at this, it's pretty close to invisible over here. So take a look and see what we were able to do with this patient's forehead scar. This was after a few months, a couple sessions here, but look at that. You can see it's pretty close to invisible over here, which is awesome. So this is a really, really nice result. Something that's really good also about this is, even though this was a traumatic scar, this also is something that we could do for other kinds of boxcar scars. So I'll walk you through this process. It was actually a pretty difficult case because of the location of the scar. If you look at it, it is right there where there's some muscle contraction. So she's somebody who's been very, very good with doing Dysport injections, Botox injections, and we're able to relax that muscle. But if there's movement there, it may not heal as nicely, and the scar may still be a little bit visible. But because we're able to relax that completely, we're able to get really, really amazing clearance here. Actually, I'm going to fit this a little better. It looks like it's kind of tough to see. Hopefully everybody can see it right now. It's kind of tough for me to tell what you guys can see on your screen. If you guys could, let me know if you could all see that result right there on that little spot. So basically this boxcar scar right there in the corner, hopefully everybody can see that there. Oh, cool. Okay. Everyone can see it there? Perfect. Thanks so much for letting me know, Sailor Moon. So yeah, it's a really good result. You can see a boxcar scar. It's a patient where she's a Fitzpatrick 2 patient. She's somebody that we were able to go a little bit stronger with the laser. I did do some subcision in her case. I did also TCA Cross, and I did ablative CO2 laser. And it worked out really, really well. I did do 2 times with the ablative CO2 laser for her. I also did a bit of Bellafill in that little spot right there, and that helped out quite a bit as well. So this is a really, really nice result, right? Really great improvement over the course of 5 months or so. And what's nice is actually I've seen her for years. She's actually somebody I've been dealing with for about 8 years because she does like facial balancing and she does a lot of toxin. And this sort of just happened to just occur to her where she had like a freak accident where glass shattered on her. And she's somebody who's also on camera a lot. It was really, really troubling for her. So it was really nice to be able to get this kind of clearance, this kind of improvement for her scars. So part of it though is also because we were able to really freeze the muscle of the scar there, so that way there's no more contraction there. Iman is saying, are fillers, i.e. Bellafill, a temporary solution, or do they create enough collagen for a permanent result? So 20% of Bellafill does stay there. There's something called PMMA, so it'll stay underneath that scar tissue. The studies showcase that it's there for at least 5 years, but really they just stopped the study after 5 years. Most people can recognize, I have some patients who've had it for more than a decade or so, and it's like just the same, which is awesome. You know, that's the truth is that we could have some volume loss, some fat loss in the future, but it's nice to have something to support the scar tissue. That's what this does, and it's awesome. And again, like this is something that we could achieve. It's just that it takes a little bit more work, and also for certain skin types, it could take longer. So like, you know, this patient, we did do 2 steps for her, but in other patients, it may take even more sessions actually. We have to learn your skin. We got to make sure it's really safe for you. Fish Floor is saying, wait, how did I do this? I did microdermabrasion, but I don't know what it really did. Microdermabrasion is not going to help really with these kind of scars, so it's not going to help enough for that. Why are my acne scars black? So a lot of times when you have acne, it could turn hyperpigmented also, and that's probably what you're referring to, I'm guessing. And so we probably have to improve that pigmentation as well. Who can I have a consultation with? Are you from Portugal? So I have a lot of patients in Europe, and we do virtual consultations all the time. We'll be happy to help you out, and you know, it's definitely very straightforward. Actually, you could just go through my page, drqazi.com, set up a consultation. You can set up a virtual consultation. They'll give you some instructions on how you could send some photos to us, and then we'll just go through everything really properly for you. How do I get rid of jowls? Surgery or treatment maybe? So really, for real true jowls, the best option is going to be really surgical. So that's the reality. If it's really true jowls, you really do just need surgery. Otherwise, it's just never going to be able to fully resolve. Sometimes we could go internally and heat up and tighten the skin. That's something that we could do. Something called face tight. That works out really, really well. But really, if it really is true jowling, the muscles pull down. You really want to pull that back, and you do that with surgery. Nargel Soul is saying, I'm using Tretinoin 0.05%, but I'm noticing a lot of dryness even when I'm using the sandwich method. Well, how early on are you with it? Try to start doing a few things. You could start doing zinc, take 50 milligrams of zinc every day, and then also start doing omega-3s. All that can actually help out. Sometimes also there's a histamine reaction that occurs, and you need to be on Claritin for a few weeks while you start when you start Tretinoin. That may be something else too. Julie saying, love the results. How many sessions were needed on the picture? So we did 2 sessions for this patient. We did end up doing fully ablative CO2 a couple times for her. We did also through the laser tunnel holes. I put a dilute form Sculptra. I did a little bit of Bellafill the first session also. Worked out really, really well for her. So really happy with this improvement. I see this was actually probably 2.5 years ago. So I still see this patient now. She comes in for some fillers and some Botox, and it looks awesome, just totally unnoticeable. This is actually, when you actually think about it, it was a really sad story because she never had acne, never had any problems, never had chickenpox, just had totally smooth skin, and just ran into a glass door at like the mall, like it was, I think, like Neiman Market, something like that. And apparently it was like under construction or so, and then like there was like shards of glass that just shattered on her face. I think she was looking at her phone, she said, or something like that. I can't remember exactly, but something like that happened. Everything was going well in life, and then suddenly she walked into this that shattered onto her forehead, and then she ended up with this big gash. There was actually these other gashes on her forehead too that healed up really nicely without needing to do too much. Just did a little bit of a lighter laser for it a bit. For just a little bit of redness at one point, but like other than that, it was actually okay. It was more just this big, like what looks like a chickenpox scar, but like this boxcar scar that occurred, and that's something that was really bothering her because it was exactly right in the center of her face, and she's just like, I'm on video all the time. She's like a content creator too, and just like it was really upsetting for her that she had this. Let's see here. Iman is saying, how long after my 4th Accure laser can I come to you for scar treatment? So usually about 3 months later. 3 months is usually a good time. I want to make sure oil production is under control. It's a good touch point. We can make sure you're on the right track, and then we can start really that process for making sure that you're ready for scars. Let's see here. This is also BB saying, this is also painful. What anesthesia do you use on patients? Subcision and Sculptra, etc. Well, Subcision actually is just the process itself. There's a ton of numbing solution in there. So we do a ton of numbing all day, all throughout the whole face there for that. We also do nerve blocks, so you're numb up there. So it's really going to be okay. And I have a lot of patients who are really worried about pain, and they're totally fine with it. There's sometimes people have a little bit of anxiety. We could give you an anxiety medication if you want. But in terms of pain, it's actually pretty well, it's well controlled actually because of the nerve blocks. And with Subcision, it's completely controlled because just tons of numbing solution there. Can you use Tretinoin during pregnancy? No, you should not. You could do something like azelaic acid. You could do 10% azelaic acid, 15% azelaic acid, but you should not do any topical vitamin A. Now, would it really be toxic? Tough to really say, but it's really not going to be. It's really not going to be recommended. Vitamin A is potentially toxic for babies, especially early trimester. So, I would not recommend it. V is saying, I have redness and scars after severe breakouts. I just want to get rid of the redness for now. I'm 16. So easy thing to do, V. You could start using actually azelaic acid, 10%. Just get that over the counter. That could potentially help you out. But also sometimes that redness is also due to really dry skin. So also considered using something like Vanicream. Vanicream works really well just as moisturizers, reapply that over and over. TikTok is saying, any friends, colleagues you'd recommend in South Florida or New York City who do similar work? There's really not many of us across the world. So there's a lot of people that do fly out. You could say Sailor Moon comes, I believe, from Arizona. And there's a lot of people really that come in from out of state. It's really something that you really do want to have somebody who specializes in, because there's so much involved with it. There's so much that we have to do. There's a lot of recovery portion of things that we got to make sure keep everything safe for you. and we do it every single day, making sure it's really safe for every patient. And it's tough if you're juggling a bunch of stuff. So that's why I just do a few things, but I don't just do a ton of other stuff. So that way my staff is really well trained in these things, and we don't miss things. Let's see, where was I at? I missed a few things here. How to prevent the possibility of breaking out post-acne? Good question. Start with some sort of topical retinoid, something like, really you should consider something like a low dose Tretinoin, 0.025%, works out really well. Over the counter, you could do different cream. Different works out well. You could just get that over the counter, but really you may need something a little bit stronger. So start really kind of going up a bit on a scale with Tretinoin. TikTok is saying, no way is he the only doctor in the U.S. who could produce these results. You know, if you feel like there's other people that are, I mean, take a look and see. But really, it's like I showcase this over and over and over again. And I was going down this route too when I had to work on my skin. And there just weren't people that I could really trust. And like even to this day, there's not people that I find that are doing it really, really safely. There's maybe a few people that could do certain things. Like I think that there are people out there that could do certain portions of like treatments, potentially like surgical parts and things like that. And there's other people who just were trained a certain way and they can't combine it and can't combine everything this way. And that's where I think like you really want to go to somebody who just does a lot of this and does it at a very, very high level, does it very safely for patients, and does it over and over and over again like that. So I think it's important just to pay attention to that. You'll see that there's a lot of people out there that claim that they do scars. I think in the future, at some point, there's a lot of people that are looking at things I do. There's people that reach out to me, and I'm happy because I think that at some point there's going to be a lot more people, really, and it's going to be a lot more accessible for people. You know, my patient today, it's a really sad story. Actually, I did a phenol peel on him today. He's somebody who he actually was on here for a long, long time, like on the chat for a long time too. And anyways, he actually had done 7 subcisions somewhere else, and then he did 10 laser sessions somewhere else, like really aggressive lasers. And it's actually a really, really sad story, because I did subcision on him like a month ago. And there's so much scar tissue in there. And I was actually very upset about it. I even came up on here and was saying that, like, I was very upset about it because there was so much scar tissue in there. It's like, I don't know what they were doing when they were doing subcision. And, he's somebody who was telling me today that, like, when I was doing the phenols on him, he's like, I've been waiting for this for like my whole life. I was bullied throughout like high school, like he had acne at a very young age. And he's just like, I've been waiting for someone to take care of this. And I've been, saving up money, and I spent so much money on other things. And it's really sad. Like, it's really sad that somebody like took advantage of this poor guy, poor patient. And they did treatments that they said that they could do. They thought that, or they're making this claim that they could do these treatments, and they couldn't do it. They couldn't do it at a high enough level, and they shouldn't have been doing it. They really should not be doing it. They shouldn't be touching patients. I can't remember the exact number that he paid, but a lot of patients could pay like $12,000 to $20,000 before they even come to me, and it's sad actually. They do so many different treatments that didn't help out for them. So, it is like the thing where I do feel like you have to go to somebody who does a lot of this and does it really well, really safely. Let's see here. Mathematics is saying, I'm on day 3 of Tretinoin 0.25, but I haven't seen purging or dryness. I've only seen good. Awesome, good. So just start with just continue moisturizing. And also if you want, try to use a little bit of zinc, as well as really consider doing something maybe with like a little bit higher, probably in about 4 to 6 weeks or so, as you're getting a little bit more used to it. Is dermaplaning okay? Do you have any opinions on it? At home, it could probably break you out a little bit more, so probably you would want to go to a professional for that. There's people that do that all the time too. So I would recommend going to that instead of doing it at home. Do you suggest using Tretinoin with the Accure laser? No, I would do that afterwards. I wouldn't do it during the time. So I don't want to overly dry your skin. Your skin's going to get used to this new normal. So for those who don't know, Accure laser works just like Accutane in normalizing the oil gland. And unlike Accutane, though, it doesn't have any systematic side effects. So it's just only for the face. And you just go about your day the rest of the day without any problems. So it just normalizes the oil gland, the thing that actually the root cause of acne. So all it does is just targets that directly. And the thing is, though, is that we don't want to overly dry your skin while it's working. So if you overly dry the skin, what ends up happening is that you have a rebound effect where you end up producing more oil to overcompensate. So that's a problem, because if that and you have a little bacteria on the surface of your skin, you could actually get breakouts then. So we do want to make sure that you're not doing things that are too aggressive, too harsh while you're doing the Accure laser. But you could do it afterwards. You definitely could be on it afterwards, and maybe even a month or so afterwards, I'll put you on Tretinoin, and that's okay. But I like to do it pretty slow, actually. Is Tazorac much better than Tretinoin, or is it okay to just keep using Tretinoin? You could just keep using Tretinoin. Whatever you want to do, it's okay. How to get rid of PIE? I may have missed out your advice. So PIE are those little red marks that occur a lot of times for patients that with acne-prone skin. That's basically when you had acne, and then you may see some broken capillaries right at that lesion that you had acne there. Easiest thing to start with is just 10% azelaic acid. See if that'll start clearing it up. But a lot of times, just with time, it'll improve with sunblock, making sure it doesn't turn hyperpigmented. But if it is still stuck, then you could use a laser. I use XLV. Other people use V-beam, DermaV. All good options there. How do you suggest taking zinc? So take 50 milligrams every day. Zinc, 50 milligrams every day. Ben is saying, slight horizontal lines on the forehead as a teen. How can I get rid of them? So horizontal lines as a teen is because you had some scars there. If you had scars, it's a little bit different than just like due to movement. If it's simply due to movement, then consider doing like a low dose of some sort of toxin, something like Botox or Dysport. If it's like due to scarring, you may need Subcision, you may need filler. If it's really true like volume loss, then you may still also need filler also. It's tough to say really what the reason for that is, but if especially as a teenager, I can't really envision due to like movement as a teenager, but it's possible. And if that's the case, then maybe just a little bit of Botox there. G is saying what to use for hyperpigmentation due to acne for darker skin. So sunblock, of course, and then you could try Eucerin's anti-pigment cream. Otherwise, come to someone like myself. I do so much with pigmentation. I'll help you out with a Pico laser. Works very, very well for hyperpigmentation. Lip flip or filler? Filler, really. Usually, it's actually the reason why you want to flip it is because of the volume loss. But if you have good volume and you're trying to get it so that it pops up a bit more, lip flip is fine. But for like a lot of patients, actually doing a little bit of filler just to give a little bit of volume, just a tiny little bit of that improves that area quite a bit. What's the difference between CO2 laser and skin resurfacing? Well, it could be the same thing, really. You could be using the CO2 laser for skin resurfacing. Today, I did some of that, but I also did a phenol peel today. Did one today, did one yesterday, and that's resurfacing also. So that's also awesome. Oh, by the way, the patient today is going to let us share results at some point. It was really nice gentleman. He was on here a long time, actually, and he's going to actually let us share, which is awesome. His scars were very, very severe. And it's going to be awesome. It's going to be a really great result. I think that we'll follow along his journey. I don't know if we put it up on our stories. I didn't get a chance, but I think probably on our platforms, we probably put it on a story at some point. What do you suggest for permanently getting rid of pitted ice pick scars? Well, it's tough to say permanently, but like we could improve it with TCA. Sometimes you excise it. You literally just physically take out the scar. That's probably one of the better options there. Let's see here. Is it safe to do excisions on the forehead if you are keloid prone? Possibly, yeah, it depends. You definitely want to make sure there's not much movement on the forehead. You want to make sure that you are doing something like neurotoxins pretty regularly there. It's tough to say if it's really something that you would do excisions with those. Can we do it? Yes. It depends on the location. I couldn't do it in this particular spot, though, because of the movement over here. She had too much movement otherwise, and I wanted to make sure that even if you do Botox, there's still maybe a little bit of that. And so I wanted to make sure that there's no more tension on the scar. So that's why I opted more for manually breaking up the scar tissue with a little bit of Subcision, placing some Bellafill, doing laser to resurface. That helped a lot more. What do you think about 15% niacinamide? Is it too high? Likely, yes. It probably is too high. And there is actually some patients who will get irritation with it that high. Are you in Toronto? No, I have a lot of patients from Toronto, though. I'll be happy to see you. What are your thoughts on Halo plus full field ablative erbium laser as a spot treatment for scars? Well, it depends who's doing that way. I mean, the Halo is going to be okay. It's a lighter treatment. Maybe that's okay depending on your skin type. The full field spot treatment for scars, it depends. I personally like the way of doing it where I go around the edges of the scar and smooth down the edges. There's some people who drill in holes with the erbium or drill in holes with a CO2 laser. And that's another concept, another way of doing it, but I do think it's a little bit less predictable. So I'm not sure exactly who you're going to, because there's very few people that I would trust for like a full field spot treatment like that. Amelia's saying, I have a scar similar on my eyebrow. It's not an angry 11, more like one. What do you recommend? And I'm not sure what you mean by that, but it's more like one. What do you recommend? Well, really, it's going to be sort of similar treatment like this. Do laser to resurface there, put a little bit of Bellafill potentially, or some sort of filler. Just hyaluronic acid filler is totally fine. And then, we just use some CO2 TCA Cross if it's needed as well. What's best to remove acne scars, creams or serums? I'm late to this live. Well, this is definitely not going to improve with either creams or serums or anything like that. This needed really proper treatments. We did laser resurfacing. We did a little bit of Subcision, Bellafill, all those. Those are things that you really need. It's just not going to help really with creams. This is a traumatic scar, even though it looks like it's an acne scar or a chickenpox scar. It's got that like the width of that, like that, it looks just like that, but it's not actually. It's actually due to trauma, due to glass. So that's one thing. Opinion on threads. I don't love threads really. The thing with threads is that it's okay for people that know how to do Subcision, for example, but it's not great really for, like, what I mean by that is if you run into a complication, it's tough because you have to actually break up that thread, actually really difficult, and like release it a bit there, and not everybody could do that really well. So it's like a lot of people do threads when they shouldn't be doing it, and also doesn't last as long as it should. There's a lot better options really. So I actually talk a lot of people out of threads, to be honest with you. And like yesterday, I had 2 people that really wanted threads. I just turned them down, and I told them to do other treatments. They opted not to do that, but it's just like, I'm doing it for you because it's just like there's too much laxity or it's too heavy. And it's like, sure, we could get a result for 3 months, but I want things to last. I want like my name or my reputation's on this stuff. So I want it like every time you're walking around the city, it's like, this is my work. And like, if I run into you, I'm like really happy. Sometimes I run into people at the grocery store, things like that. And it's like, it's happy. And it's like, it's awesome. Those look good. I'm like, oh yeah, those look like good lips or something like that. I did that, I was thinking the other day, I was like, one of my patients, I hadn't seen her in a little bit of time. She came in for Botox. I was like, oh wow, these lips look really good. And I realized, oh yeah, I did those lips actually a little while ago. It's actually nice. Like, it's a good feeling. Imagine if it was the opposite. I'm like thinking to myself that, man, what happened with these? And then it occurred to me that like I was the one that did that. So it's like, it feels good knowing that I could do it like a natural way and like it looks great. So it's like, I want to always do it that way. I want it to like last like that. So it's part of it's just like that matter of like pride. Just like pride in my things I do, and I want to make sure that this stuff is going to last you. It's like going to be really satisfying for you. Let's see here. Up is saying, or is that Cross? I can't tell. CO2 laser, Subcision, microneedling, chemical peel. In which order do you recommend to do treatments? So I'll probably put away the microneedling. Most chemical peel is not going to be too helpful. Subcision, CO2 helpful though, depending on if you have like rolling scars. I'm guessing that's what you have if you're talking about Subcision. Although it could help for some boxcar scars. We did it for this patient, for example. Could even help if it's like really dense ice pick scars. It depends on who you're going to, really. That combination sounds like somebody who doesn't do much with scars, though, to be totally frank and honest with you. So it's a little bit questionable of a combo there. Would fungal acne be considered acne? Yeah, it could still scar even too. So yes, it's still a form of acne just because it's not a bacterial component of it. There's a fungal component of it. You still got to control that fungus though. And it can be difficult, really. It will be really tough sometimes for some patients. And it's, a little bit longer of a journey sometimes. Kanye is saying, I guess a different kind of Kanye. I have hyperpigmentation around my mouth. I've used creams, adapalene, tretinoin, and they don't work. It's possible that it's a form of melasma, and it sounds like you're not using much of anything for actually lightening this. We're actually not doing anything to lighten the pigmentation. So maybe consider something like hydroquinone, just a low dose hydroquinone, 2%, 4% hydroquinone. That probably is what you end up needing to do just to see if that'll help out with there. Justine is saying, how the heck do I get the little white bumps on my chin, nose area gone? And those actually sometimes you do have to burn those down with a bit of a laser, or you do electrocautery. So you just like put a little needle there and zap it with electricity, and it burns it down. So that's probably what. Is microneedling permanent for my acne scars? I mean, if it does work, that's great. It's just very few people it really helps with, to be honest with you. And that's why so many results, when they showcase for microneedling, it's just like a week later. It's not going to help you out much. What's a downtime for CO2? Most patients about 4 to 7 days, really. Because I do more like localized. I don't go like high heat, high energy throughout the whole face. So just more like just localized. What is BBL Moxy good for? So BBL is really good because it's broadband light, especially for acne. Works really well for that. It can help in certain skin types, better for really for the redness, for some pigmentation. But I do find it's really, some more like a jack of all trades type of thing. I usually prefer more like precise lasers, like pico laser for pigmentation or XLV laser for redness. Moxy is okay, is a light resurfacing type of laser. Sort of not great in my mind for most things though, but like it's okay. It's kind of expensive for what it is. I prefer more like an erbium laser. That's like my go-to. And there's a lot of people who have gotten Moxy done and they were not the right skin type, or they had melasma and their melasma got worse. So it's definitely not something that I would really be pushing for a lot of patients, really, or just recommending them, because as you see on here so many times, people would say that it just didn't work out for them. Sierra Torres is saying, what is the best way to treat a boxcar scar on the middle of my nose? Well, it depends on really what kind of scar it is, how deep it is. If it's something that it can lift up with a little bit of volume, surprisingly, you could put a little bit of Bellafill in there. It works out really well. I actually did it yesterday on a patient, an African-American patient, and we definitely didn't want to go really ablative and go really deep with her skin. I did do a lighter blend of an erbium laser for her boxcar scars, but I actually used Bellafill for it. It works really, really well, lifted it up really, really beautifully, and that's something I would probably consider doing. So depending on where it's at and if it really could improve with volume, that's an awesome option. What helps with the appearance of keloids? Well, it's really a lot of times red and angry. So you do want to use a steroid shot. A lot of times that's going to help relax it. You also could do something like XLV, which is going to help with the blood vessel form of it. So all that redness is going to help relax that. And then you want to use silicone tape. Silicone tape is actually going to help keep it flat. So you want to use silicone tape, especially in the areas where there's a little bit of friction. So all those are good options there. Are there ways to address cheeks, jaw, fat skin starting to drop in the mid to late 20s? Well, it's tough to say. I'm not sure how much volume loss you've had, but it sounds like you may have a lot of volume loss, and then that may be more surgery. But if it's more like just like a pretty mild laxity, just a little bit, then you could consider doing something like collagen stimulating products. Things like Bellafill could work well, Sculptra could work well. All things could be options there. Radius. I'm saying those because I want to improve your skin, because there's a little bit of laxity there. Sorry, I just came in. What methods did you use for the scar? I did a couple sessions of ablative CO2 laser. I did Bellafill, TCA Cross also. Through the laser channel holes, I put a dilute form of Sculptra. It worked out incredibly well for it. And really, for the last 2.5 years or so, I think maybe 2.5 or so years now, she's been pretty scar-free. So it's just pretty awesome. Really, really cool. Super satisfying results. I'm going to end over here. I had a really, really great week of a lot of cases. Like I said, there's a couple people that are going to let us do share some results maybe soon that we just worked on this week. So hopefully we could get those results coming in a few months too, which would be awesome. All right, guys. Thank you so much. I'll see you again on Monday. Take care.